uncontrolled sugar. Anything in the eye? Yes, of course. Two things. One is a cataract, the second one is diabetic retinopathy. Hello everyone. My name is Priyam Sigdal, 23-year-old from UCMS Bhairava, and I am an MBBS student, and today I'll be talking about two important topics. I'll be talking about cataract, which is caused by diabetes, and I'll be talking about diabetic retinopathy. So let me make you understand these two concepts in a very easy and a very understandable words. If you have a high blood glucose level, that glucose can go to any site of your body. It can go to your neurons, it can go to your blood vessels, it can go everywhere, right? Similarly, it can go towards your lens, and when that glucose goes into your lens, it is highly water loving and that imbibes in water. Okay, so if in case there is imbibition of water inside the lens, okay, if there is which should not be there, actually the water is not intaken upon by the lens, because there is a presence of endothelial cells which has a pump mechanism, and that tends to remove the water from your lens so fast. Okay, but if in case there is a pump failure which happens because of accumulation of these hyperglycemic substance, these sugars inside your lens, that will actually lead to an activation of sorbital pathway, the poliol pathway, and then that will lead to cataract. What about diabetic retinopathy? Understanding this concept is quite difficult, but let me make it really easy. The major pathway of all the diabetic retinopathy is neovascularization. So there is much more blood vessels which is being formed in your eye, which has a very fragile blood vessels, and that will lead to excessive hemorrhage. And if there will be an excessive hemorrhage or excessive blood loss from that particular blood vessel, it will lead to something which is known as neovascular glaucoma, rubeosis iridis, neovascular glaucoma, and it will lead to a blinding complication. So we don't want that. So what we do is we just go for a anti-VEGF injection, or we go for a photocoagulation. So remember to control your sugars. Remember to be on your anti-diabetic medications. Okay, if you are under insulin, remember to be under your insulin, because if you are not under your insulin, if you are not taking your anti-diabetic medications, you might land up into being a cataract patient or being a diabetic retinopathy patient, and there'll be a lot of problems. Thank you.